Okay, good morning, everyone. We're delighted to start the webinar and are really excited. We have nearly 300 people registered. We're looking forward to your comments, your questions, and you know, we had obviously planned to do this at CSW, but due to the COVID-19 pandemic now, we're doing this online. The silver lining, of course, is that we get to reach a larger audience across the world, and we're very excited to share this presentation with you this morning. You'll see we've got a fantastic group of speakers this morning, really some of the experts working on the issue of children's exposure to violence and how we interrupt intergenerational cycles of gender-based violence. Angelica Pino is co-moderating with me from Sonke Gender Justice in South Africa, and she will introduce the panelists in just a moment. But I wanted to start also by, if I can figure the technology out, and you'll see the technology has been a little bit of a challenge, but wanted to start by also announcing that we have a fantastic new literature review which goes live today, should be up on our website either now or very shortly. And that literature review chronicles some of the evidence-based practices around the world that work to reduce children's symptoms of trauma, and we think offer some promise for interrupting cycles of violence, reducing the likelihood that those exposed to violence go on to experience violence. And if I can figure out the technology, I hope I have just brought that up, although I don't see it. So do my other panelists see it?
Yes, Dean.
Great. Good.
Perfect.
So
but
yeah,
you have to go back to slide 1, Dean. You're in slide 3 right now.
Okay, I'm going to need a little bit of help here because somehow we've changed the settings on my screen and it's not showing on my screen. Aha. Okay, let's see if we can do this.
Oh. You also need to put it on slide mode. So there. Perfect.
Okay, fantastic. So what you see in front of you is the hot off the press literature review. And you'll see there the authors listed, Catherine Carlson, Laura Vargas, and Karen Eichenberg, a great group of international experts from across the world who have reviewed it. And we shared this at a meeting in Cape Town in late October. And I won't get into the specifics of it, but I think bottom line, as I just mentioned, lots of evidence of interventions that have been rigorously evaluated and show success in reducing the experiences of trauma of children exposed to violence, and as I mentioned, also offer some promise of interrupting cycles of violence. And so we encourage you to have a look at that up on our website and to provide us with comments. I also want to just start by framing this a little bit. We have known now for, I think, 2 decades plus that there is a very strong association, and we're going to hear about it from Leila and from Chrissy, between exposure to violence and subsequent perpetration. And here at Promundo, our International Men and Gender Equality Survey, which we have implemented in nearly 40 countries around the world, shows that association very, very clearly. If you see the map there, those are the countries in which we have implemented images. And what you see there is a very strong association found in the images study between young men's witnessing an exposure to violence in their homes and subsequent perpetration. It is the strongest predictor of a man's use of violence, and we're going to hear much more from that. So I think with those opening comments, I'm going to turn it over to Angelica. So over to you, Angelica. Angelica, you'll need to unmute.
So yes. So yeah, hello everyone. I'm really pleased to be in this webinar with Dean. We were supposed to be, of course, all of us in New York, but we know what's happening, so technology is helping us now. I'm really very pleased to have the panel we have today. And now let me introduce, I would like them to introduce themselves one by one. If we could start with you, Leila.
Would you like me to start right now?
Yes,
Okay.
so just introduce first round of introduction of the panelists, just your name, your position and the organization, and then we're going to go to the
Sure. Sure, thank you so much. And I was just in South Africa, so a beautiful country. My name is Leila Milani. I'm the Senior International Policy Advocate for Futures Without Violence. And my area of focus is the international space where we try to respond and prevent gender-based violence, which, takes into account the whole of family. Thank you.
Christy?
Sure. Good morning, everyone, and thanks, Dean and Angelica, for convening us and for everyone being really nimble with the remote challenges. I'm Chrissy Hart, Senior Advisor with Together for Girls. I am based in New York, where I lead our engagement with sub-Saharan African countries that are conducting a violence against children survey, and also steward some of our UN relationships and lead on some of our advocacy work. Great to be with you this morning.
Claudia?
Good afternoon or morning, everyone. I'm Claudia Garcia Moreno, and I work at the World Health Organization. And happy to be here in spite of the challenges of the electronic means.
Thank you, Claudia. Alessandra?
Hi, everybody. I'm Alessandra Guedes. I'm now turning on my video because I don't have the bandwidth to do so. I'm coming to you from Florence, Italy, where I am based at UNICEF Innocenti's Office for Research. Joined that office 6 months ago as the Manager for Gender and Development Research, and have been working in the area of violence against women and violence against children for quite some time. Most recently, 10 years at WHO Americas. Thank you.
Thanks so much, Alessandra. Sujata?
Hi, everyone. My name is Sujata. I coordinate the Global Working Group to End School-Related Gender-Based Violence. It's a coalition of organizations hosted within the UNGEI Secretariat and co-chaired with UNESCO. And I sit in New York in the UNICEF office. Very happy to be here.
Thanks so much. And the last but not least, Katharina.
Good morning or good afternoon. My name is Katharina Anton-Axley. I recently joined the Global Partnership to End Violence as a gender and education specialist. I'm specifically focused on the Safe to Learn initiative. I have been working in the field of violence against children prevention for some time, previously with USAID and now based in New York. Thanks.
Thank you so much, Katharina. And I just wanted to, all of you can see some slides in the screen. I just wanted to tell you briefly about Sonke's interest and involvement in this area of work. In the year 2016, we studied a randomized controlled trial in a pre-urban area of Johannesburg called Diepsloot. It's a township, very hard conditions, a lot of poverty, really deprivation. And what we did was, with the partners from the School of Public Health at Wits University, we ran a survey. We talked to 2,604 men about their lives and about perpetration of violence. And the median age was 27 years old. 58% of them said they had perpetrated violence against women in the 12 months before. That's a huge number. It's double the average in the country. And we know South Africa already has huge levels of violence. And we were actually recording perpetration of intimate partner violence, of sexual violence and physical violence, and also a non-partner sexual violence. So we were really, really kind of going for quite hectic manifestation of violence. 60% of those men said they have done it multiple times. So we wanted to know what it was about the lives of these men. And that's what I think you can see in the screen, just to link with the topic of the webinar. 39% had a problem drinking, 42% had probable depression, and 57% had experienced adult trauma. If we can go to the other slides, Dean. Dean, can we move to, yeah, there we go. Then that's perfect. So that one also shows the correlation between the problem drinking and the possible times of perpetrating violence. 2.5 more times of being a violence perpetrator. In the case of depression, 0.5 times. Having experienced other trauma, chances are twice also of perpetrating violence. Can we see the other one? Thanks. Then, this is where we also really links to what we are talking about today. 30% of those men had witnessed IPV in their childhood. 84% have been abused in childhood. And 1/3 of them had experienced had been raped or experienced sexual violence. And also in case of nearly 2/3 had actually a drinking problem. So for us, that's what we know, like Dean said, we know there is a correlation, but in this case was really for us kind of wake up call. We never thought we will find those levels of violence, first of all, and secondly, also the trauma among these men. And again, I think that's going to be the conversation. It's not about justifying, it's about what do we do about this. So we have really taken the issue of the linkages between exposure to violence of children and later perpetration quite seriously. We are involved also in a banning of corporal punishment campaign in this country, which actually has been successful, but we know we have much more to do. So I just wanted to show you this is what we are doing in South Africa. And now we can move to the presentation of the panelists. And the first one is going to be Leila. If we can have Leila's presentation. Leila, as she introduced herself, is from Futures Without Violence, and they've been working on the issue of children exposure to violence for many years now. So if you could tell us, Leila, why do you think it's important to work around this? And how do we do this from a feminist point of view? Because we know there have been tensions between the feminist movement and the children's rights movement. So how do we make these movements work and along the same lines and having in mind prevention in the end? Over to you. Leila, I think you're in mute. Leila? Hello? Leila? Leila, we cannot hear you. Leila, we cannot hear you. Oh, okay. Okay.
Okay, here we go.
Can you hear us?
Perfect. Yes, we can hear you. Go on, thanks.
Yes, and now the audio is good. Now we need the visual. I'm waiting for the slides to come on to guide the discussion. That's okay. By the time we get to the fourth panelist, it'll be running very smoothly. Copy.
So we're doing everything we should be doing, and it is just not coming up for some reason. So do we have any?
Would you like me to speak anyway?
Yeah, I'd say go ahead and speak to your slides.
Yeah, maybe
Okay.
you can just go and speak. I think that's fine. Yeah, let's do that. We are going to share in any case all the presentations with all the participants. So yeah.
Sure, absolutely. Yeah, and once you can see the slides also, it just helps with the flow of the conversation. But thank you again for the opportunity to speak about this compelling issue, and in the sense that it affects, oh, wow, the power of just moving along. We can go, do I have control to move it, or we can go to the next slide? Okay. So as the participants, the panelists, and the people joining us online already know these facts, so I don't want to spend too much time on numbers, but we all know that we have a problem. We have a problem that 1 billion children in the world are exposed to violence each year. Not just, that is not a problem just because of the pain and suffering and psychological, physical, emotional damage that does to that particular child, but in the context of our work, we also want to look at it as the impact that violence has on the whole of family and the generations to come. So if we want to build a society that is healthy and safe and geared towards progress of all, then we have to do everything we can to reduce the exposure to violence. And also the second part of that, there's the intervention and reduction, but then there is the how you respond and how you treat and how you heal those that are impacted. And the main reason is that the damage is significant and lasting. Next slide, please. So what I wanted to share with you quickly, and then this really will open up when we have questions, is at Futures Without Violence, in everything we do in our work dealing with violence, we have almost a triple layered approach to it. The first being that we do a great deal of work on trying to educate the people we work with, the people in the communities that at the grassroots and at grass tops levels on the problem of childhood trauma. And also at the same time, we like to offer the solutions that exist, because to just hone in on the problem can have a disadvantage when you're not coupling that with solutions, because you really want to prepare the community to do something about the existing problem. We do that through advancing programs and practices that help make schools, homes, and communities safe for children and youth. And also we like to approach this from a perspective of growing the knowledge base of our leaders, our community leaders, our teachers, our educators, our healthcare providers, every space in the community that people could serve as a point of contact with those that have experienced violence, individuals who are in the positions to make a difference in the lives of those who've experienced violence, to also prevent the backlash of, which I'm going to go into in the next slide, and the negative impacts of having too much information or information about a problem that could end up hurting some of the people impacted. I will highlight later on in the slides one of the programs that we have just started working on, which is very impactful, called Changing Minds. We partnered with the U.S. Department of Justice to create this. It's available on our website, and so folks who are participating will have access to not just the information, but even the tools that we use to help in their own communities. This campaign is designed to raise awareness, teach skills, and inspire public action to address a hidden epidemic, at least focused in America, but as we know, this can translate throughout the world. Next slide, please. So one of the questions that had been raised to us that we really wanted teachers to address is, before going into the other details of our work, is what happens when we do a great job of raising awareness in the community about the impact of children's exposure to trauma, to violence. Well, the good news is the more we raise awareness, the more people want to protect the children, the more people want to be engaged and come up with ways to, create spaces for those children to be safe. However, what can also happen is this notion of what we call here in the U.S. the failure to protect. So those children who are being exposed to violence, sometimes the very keen eye turns to those who are taking care of them, and let's say in a setting where there's a family involved, and let's say in the setting the father is the perpetrator, the judging eyes also turn on the mother in this context, in that, so you knew this child was experiencing violence, you knew that it has and we know that it has traumatic effects, it can affect all kinds of their learning, their emotional, psychological, physical well-being, and yet you did nothing. You should have known. You should have taken steps to protect this child, and you didn't. As a result, this expectation of you should have known, you should have done something, has created a backlash of actually either removing the children from those homes, even though the mother was not the perpetrator, or one of the parents was not the perpetrator of the violence, creating and increasing the traumatic experience on the child, punishing the people who may not have been the ones responsible for the violence. So how are we at Futures Without Violence working with that knowledge? How do we try to safeguard that? How do we try to protect those who could be, as a result of the increased awareness, be impacted by this? And we see this happen a lot. Children are being removed from homes where the mother is now the one that, so to speak, does not have clean hands in the eyes of the judicial system, because they didn't do anything to protect the child. So the response we have at Futures is twofold, actually. We believe that we need to work on advancing women's reports and challenging traditional gender norms, along with efforts to increase awareness about violence against children. So not just working on the awareness raising, but also developing programs and trainings and education that strengthen the ability for the women to do the work of, whether it is the removing, and it's not always women, it's whoever is the individual who wants to protect the child, so that they're able to protect the child, but also at the same time really working at a prevention level of changing norms, changing gender norms that are contributing to the problem of the violence perpetrated by the men or the males in the community. The solutions that we have set forth in our organization are engage men and fathers to help change norms, intensive trainings with judges and child protective workers so that they can better understand the dynamics of domestic violence, that it's not always an easy black and white issue. There's gray areas, and there is concerns about the roles of each of the partners, and work on legislation as we have in Violence Against Women Act in the U.S. that provides programming that help men become nonviolent as parents. Next slide, please. So that's kind of our response in the sense of how do we deal with the awareness and our campaigns. But what I wanted to also draw your attention on is what happens when the children are exposed to trauma, what happens long-term to that child, but also how does that translate into it being passed on generationally, because we are talking about the intergenerational impact. And the simple science, I will try to make it very quick, but you'll have the slides, and if you need the resources, I will send those forward too. So, so how does this damage the young brains, and how does this damage to the young brains pass down from one generation to the next generation? And I have to be, kind of raise this one point. In our advocacy work in trying to address violence against children, the minute in our advocacy efforts on the Hill with members of Congress, the minute we talk about the intergenerational impact and how this could be passed down, that's when we've seen the most interest from our members of Congress it's unfortunately not when we talk about violence is bad, children are affected, but it's when we say, and generations can be affected down the line, and there's science behind that, that's when we see, oh, okay, well, maybe we do need to do something. So the way it works is, if you may already know, is that all of us, and this is a protective measure, when we experience trauma, our hormones work in such a way that our brain releases cortisol and adrenaline. It's our fight or flight. Some of us stay in and fight the fight to respond to the traumatic experience, and some, in different situations, we find safety, we leave. Both of these are good. These are our defense mechanisms. It's a way we survive. It's the way we can make it through the traumatic experience. However, the problem is that it still has an effect, this response, because we're not really supposed to be experiencing trauma. We don't want to live in a society where our mechanisms are supposed to be kicked in constantly. So what happens when the psychological process impedes our neural development, and basically it impacts us. And what happens, and I'm going to go fast because I think I spent too much time on the earlier part, is but this experience that we have can be reversed and reduced with certain mechanisms in place. And that mechanism that at Futures we talk about is, if children receive comfort and support from a trusted adult, the body's stress system returns to normal. And that's the Changing Minds program that we have. Next slide, please. Next slide, because I already brought this up. And I did want to bring up how this impacts us intergenerationally. So, and this is the epigenetics, the science of how this is transferred from one generation to another generation. So we all have our own genetic makeup, but research in the area of epigenetics shows that life experiences all can impact how our genetic makeup is presented or is expressed. And when we have these experiences in the trauma, and if it happens regularly, if we're constantly kicked into this flight or flight mechanism that protects us, then there are tags that are formed on our DNA. And these tags are then passed down from one generation to another generation. That's why you see that it's not just the immediate exposure to trauma that's passed on. It could be that a child who's never even experienced a trauma can get that genetic tag onto their gene pool because their father or their mother experienced it. Next slide. And that was the bad news. The good news is that we can reverse this. Programs like Changing Minds that we have on our website, and it's available, are there to reverse the impact. And they're not that complicated. They're not that expensive. And will increase the protective psychological factors. Last slide, please. And they're called gestures that can heal, and that basically need adults to be aware of how it is that they can create that safety to reduce the trauma experienced by the child. And those are the gestures that can heal. It seems very simple, but our science shows that they work. To celebrate the child, to comfort the child, to listen to the child, collaborate with the child, and to inspire the child. Everyone in the room who's been a parent knows that when the child is experiencing this traumatic experience, the loving support of a parent, and quite often, not just a parent, but another caring adult, can make the difference. Thank you. I'm sorry if I went over.
Leila, thank you very much. And, you know, Futures has been a long-standing leader in this work. And I think you did a really great job of laying out for us the psychological, the physiological, and the social learning pathways affecting children so much. And so thank you very, very much. I think the question you raised around failure to protect is also really critically important. And, you know, of course, it makes no sense whatsoever that survivors of violence are penalized for not being able to protect their children from the violence perpetrated against them. And so we know this is a problem here in the US. In fact, it's a growing problem, and we also know it's a problem in other countries. And so one of the things we are paying close attention to as we do this work is to make sure we do everything we can to address and to try and stop failure to protect or similar penalties that are imposed on women. So thank you very, very much for your presentation. And we're going to turn now to Chrissy Hart from Together for Girls. Now, Chrissy, you at Together for Girls have done really amazing work with the Violence Against Children surveys that you've rolled out over the last half dozen years in many countries around the world. And I know you've got some important findings to share with us about what you're seeing in the Violence Against Children survey. So I'll turn it over to you. And Chrissy, just remind me, if you would, do you need me to put your slides up, or are you going to manage that yourself?
I think I can manage that myself, Dean. Thank you.
That's a whole lot safer. Thank you. Over to you.
Great. Okay. I think that maybe you have to disengage your screen sharing for me to engage mine. Oh, there we go. All right. Okay. Let's see. I don't know if I can actually share right now. I think I have to have had that set up previously. Oh no.
The share feature in the middle.
Just click where it says share and put your PowerPoint on the screen.
Okay. Let's see. Okay. Yeah, it's asking me to rejigger some settings. Let's see. So sorry. All right, that might have done it. Can you see my desktop now?
Stop.
Dean, I've just sent you my presentation. If that ends up being easier.
Let me see what I can do.
Chrissy, we can see your desktop, so you just have to project the presentation.
Perfect. Thanks, each other. All right. There we go. Okay. There we go. All right. Can everyone see that now?
Yes, Chrissy.
Fantastic. Thanks, Alessandra. Thank you. Great. Okay. Thanks for bearing with that, everyone. Great to be with you this morning. So to begin with, I'm just going to briefly introduce the Together for Girls Partnership and the Violence Against Children and Youth surveys, known colloquially as the VACs. For those who are less familiar, I know this is redundant for some of you, so thanks for bearing with me. Then I'll discuss some findings from the VAC surveys regarding witnessing violence as a predictor of experiencing violence, and the particular impact of witnessing and experienced violence on boys and men specifically, as we've found from the VACs. So Together for Girls is a unique public-private partnership. We're comprised of the US and Canadian governments, 7 UN entities, including UNICEF, WHO, and the Global Partnership to End Violence Against Children, as well as private sector supporters. So using data as our guide, the TFG partnership aims to raise awareness, promote evidence-based solutions, and galvanize coordinated action across sectors to end violence against boys and girls, with a specific focus on sexual violence in girls, but certainly not to the exclusion of boys. Our model is three-pronged, as you can see. I'll be focusing on the data-specific component of our work today. So we currently work in 23 countries that have or are in the process of implementing a Violence Against Children and Youth survey. You can see the rundown here. The lion's share are, as you can see, in sub-Saharan Africa, and that is because most of our funding for the VACs currently comes from the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, the US government-supported global HIV/AIDS program. So of the countries that have implemented or are in the process of implementing a vax, 16 thus far have published a vax report, and you can see some of them here. We have several countries that will come out with a report within the year, including Cote d'Ivoire. Kenya will do its second, Namibia, Mozambique, and Ethiopia is currently undertaking a vax as well. So the vax is a national household survey, a three-stage cluster sample survey design. The survey respondents are two groups, 13 to 15-year-olds who are asked about their experiences of violence in the last calendar year, and then 18 to 24-year-old males and females who are asked about their all-time experiences as youth. So it is retrospective. It is led by national governments with technical support from the CDC, coordination support by UNICEF and other multilateral, bilateral, and civil society institutions within country, where relevant HIV testing and counseling is included as part of the implementation process. So the topics covered in the vax include prevalence and the context around physical, sexual, and emotional violence against children and youth, risk factors and demographics, health outcomes, risk-taking behaviors as a result of experiencing violence, HIV/AIDS testing behaviors, and gender attitudes. So by way of example, this graph shows overall rates of physical violence experienced by boys and girls in 15 vax countries. You can see that overall boys tend to experience more physical violence than girls. The vax specifically asks children and youth about witnessing violence in the home in childhood in order to understand that relationship between exposure to and the risk of experiencing violence. So here's some overall data, percentage of youth who witnessed physical violence in the home prior to the age of 18 as reported among an 18 to 24-year-old cohort. You can see that those numbers are quite high. We'll take a deeper dive by way of example into just 3 specific countries. So looking at recent surveys conducted in the last 3 years in Zimbabwe, Honduras, and El Salvador. Findings from these 3 countries demonstrate a consistently greater risk of experiencing violence for children and youth who witness it in the home. Moreover, we found that exposure to violence in the home is actually the single most consistent predictor of violence. So some additional findings from studies using the vax. One of the earliest studies that was published on vax found that in Eswatini, which was the first vax survey that was conducted, witnessing violence before age 13 among girls was one of the strongest predictors of childhood sexual violence. And I will share these studies as follow-up along with the PowerPoint presentation. I'll share links to them on the CDC's website. A study using Malawi data a few years ago showed that men who experience physical or sexual violence as children are much more likely to perpetrate violence toward a partner as young men. This study shows the intergenerational links between violence against women and violence against children. A study summary is not here, but again, I will share those. And then another study using data from Malawi, Zambia, and Uganda found that children who experienced violence in childhood were much more likely to perpetrate violence toward anyone, and that was in all 3 country contexts. So again, we're called Together for Girls, but our work focuses on all children and all forms of violence. And we're particularly interested in unpacking the gendered nature of varied experiences of violence. So I'm going to turn now to some of the data specific to boys. So we know from the data that boys and men are vulnerable to and at greater risk for specific forms of violence. That shows up time and again across surveys. So by way of example, corporal punishment, child maltreatment, bullying, certainly peer violence tends to be very high among boys, also dating violence and IPV, as well as sexual violence. This graph demonstrates that girls generally experience higher rates of sexual violence, but we find that boys consistently experience unacceptably high rates of sexual violence as well. And I'll turn to the implications of that in just a moment. So boys face high rates of emotional violence and especially physical violence, as mentioned, demonstrated here. Some of these numbers are incredibly high. And this graph shows that boys are at risk throughout childhood and adolescence. You can see the strata of the age of experience of a first experience of sexual violence prior to age 18. So Additionally, boys are often experience multiple incidents of sexual violence, and you can see here that a majority in all of the countries included in this slide, a boy will experience multiple forms of sexual violence and not just one incident. And so in terms of the intergenerational cycle of violence, boys in Nigeria and Malawi, is demonstrated on this slide, who experienced sexual violence in childhood were almost twice as likely to perpetrate it against an intimate partner. And then here we see that boys in Nigeria who experienced physical violence in childhood were 3 times as likely to perpetrate physical violence against an intimate partner, while boys in Malawi were, again, twice as likely. So the VACs provide us with an immense amount of information regarding experiences of violence, witnessing violence, and the context in which violence occurs, from the nature of perpetration, the identity of the perpetrator, the environment in which violence takes place, health consequences, et cetera. But I think one thing for our purposes that's really interesting to consider is what the VACs tell us about disclosure and whether children and adolescents who experience violence are disclosing, seeking, and accessing services. So as you can see from this pyramid graphic, the attrition from disclosure to service seeking and receiving is really alarming, but provides critical information for policymakers, for practitioners, and for advocates in seeking to strengthen policies and public health systems and response in order to really interrupt that cycle of intergenerational violence. Lastly, before I wrap up, I just wanted to mention a new knowledge product that Together for Girls released in the last couple of months, and in partnership with many of the panelists on this call. So our new resource is an evidence review of best and promising practices to prevent sexual violence against children. We used the INSPIRE framework as our guide, as the foundation, as we conducted a search for both rigorously evaluated interventions and approaches to violence prevention, but also promising practices with strong qualitative evidence that has not necessarily been rigorously scientifically evaluated with an RCT, but is showing very promising and encouraging results. We compiled them into a long form report, which is available on our website, a shorter executive summary, and a host of additional resources that you can find on the website. The address is here. And the review details interventions that are aimed specifically at parent and caregiver support, very relevant to this conversation today. Best practices and effective interventions, including home visit programs like the Nurse-Parent Partnership, and programs to improve parent-child communication, like Families Matter. And so I will leave it there. Thanks very much. And yeah.
Remarkable to see how consistent the findings are across, Angelica's data that she presented from Deep Fluid, our data from the Images survey, and then your VACs data. And it shows so clearly the consequences of exposure to violence for both boys and girls. So thanks so much for that. In your presentation, you also talked about the dire shortage of critical services. And so I'm going to turn to you, Claudia, to talk a little bit about what the World Health Organization is recommending national governments do to address the phenomenon of children's exposure to violence, and how they do so in a way that doesn't engender some of the problems that Leila talked about in terms of policies that penalize survivors of violence. So over to you, Claudia. Thanks so much.
Okay, hopefully I won't have the challenges with the screens, but let me just, okay, now. Okay, can you see my screen?
Not yet, Claudia.
Not yet.
Oh, interesting. Okay, can you see it now?
That's looking promising. There we go.
Okay, thank you, Dean, and thanks everyone. It's so fascinating to hear and to catch up with so many things, and congratulations on your new publication. Looking forward to dive into it. So I'm going to share with you some of what WHO is doing in the area of violence against women and violence against children. And I've literally, as people were speaking, as the previous two speakers were presented, added 2 slides to my presentation. One of the advantages of this, one is to remind us that violence against women, and in particular intimate partner violence, is very, very common experience in women's lives. The 2013 estimates, which we are about to update, and hopefully we will see some change, I don't know yet. 1 in 3 women throughout the world had experienced physical and or sexual violence by an intimate partner, or sexual violence by a non-partner. And the map shows the intimate partner violence rates, which, as you see, vary enormously. And I'm raising this because the exposure of children to violence starts already during pregnancy. And we have incredibly high rates of intimate partner violence during pregnancy. Globally, there's a very wide range from 3 to up to 30%, and particularly in low and middle income countries, extremely high rates. And just from a study that we did in South Africa in 3 antenatal care clinics in Johannesburg, we found a rate of 27% of women that had experienced either physical and or sexual partner violence in the past 12 months. So I want to just put that to frame a little bit what I'm going to say. The work of WHO is guided by the resolutions and the agreements of the World Health Assembly, which is the gathering of ministers of health from around the world. And as many of you know, one of our main roles is to determine standards, to set standards and to develop norms and guidelines to guide prevention and response to public health issues. And we also work with governments to help them develop and implement policies and programs that are consistent with those evidence-based guidelines and those standards. And lastly, we do research and we produce and collate evidence to guide both the norms and the standards and also programs. And a very significant thing for us was that at the World Health Assembly in 2016, ministers of health adopted this global plan of action on strengthening the health system's response to violence, in particular violence against women and girls and against children. And it provides, it includes actions for both WHO itself as a secretariat, for governments, and for other partners along these 4 strategic directions. And I mentioned this, why this is important, because first of all, it gives us the mandate for the work, but alongside the commitments made, the SDGs, it represents commitments that governments have made to address these issues. And it's a useful tool also for demanding accountability around this. And it sort of gives us the political backing for the normative work. We tend to think of the health sector, obviously, immediately as the provider of services to survivors and their children. And this is a very important element, and we see it as sort of a, we see it as part of prevention in terms of preventing recurrence and mitigating some of the negative consequences. But we also see the health sector as playing an important role in other areas within the context of a multi-sectoral response, which obviously requires coordination with other sectors, but in collecting data to make the case and to also inform and evaluate policies and programs, and in supporting prevention efforts. And also as an important advocate for the recognition of violence as a public health problem and the bringing of solutions. So we sort of work across all of these areas, but obviously we have a strong focus on the service the response from the health sector. We have a lot of tools to support health systems in responding. We produced evidence-based guidelines in particularly violence against women and non-partner sexual violence in 2013. This was followed by clinical, by implementation tools, more practical implementation tools. We have also developed guidelines on responding to children and adolescents who have been sexually abused. And now we are moving forward with also new guidelines on responding to child maltreatment more broadly. And we are in the process of developing a clinical handbook that will bring it all together so that there will be one guideline on how to address and respond to child maltreatment, including the sexual piece, as well as a training curriculum. We also have 2 frameworks for addressing prevention, which I think many of you will be familiar with. We have Respect Women, which is on preventing violence against women, and we have Inspire, which is 7 strategies for ending violence against women. Inspire also has an implementation handbook and lots of very useful materials, and has been working with 15 Pathfinder countries, but obviously a lot of other countries have expressed an interest. And one of the strengths of both of these frameworks is that they have been endorsed by many different agencies, UN agencies and other bilaterals and others. And one of the drivers certainly for the Respect framework was to try to develop a more coordinated voice across the different agencies, both UN and others, so that we are going to countries with, not 3 or 4 or 5, similar but slightly different frameworks, but that we try to unite. And I think Inspire has been very useful in that way. We see these as complementary. Obviously, we recognize that the prevention of violence against children and adolescents is one of the key strategies for reducing violence against women. And I think that has been very clear from the data that was presented. So if you look at Respect, each of the letters stands for a strategy for which we have some evidence of interventions. The C stands for child and adolescent abuse prevented. And we, as has been said, see this as a very important. But you will see also, this is the 7 strategies of Inspire. And without going into the details, there's a lot of there's common strategies around, for example, transforming gender norms, around, reducing poverty or strengthening income. And we see these frameworks as complementing each other and working with countries to use them to strengthen their programs and to identify different entry points. In some countries, there's a lot of work already going on around violence against women. In other countries, there might be more going on violence against children. So I think one of the issues is how do we identify the opportunities to bring these two together and to, develop more coherent programs. There's a lot of other work which is related, even though it may not be focused specifically on violence. Just last week, WHO launched a guideline on improving early childhood development. It does reference violence against children in particular, but there's definitely scope for more integration of violence against children issues in this area. There is some work that I think is very relevant to what has been highlighted, in particular around addressing childhood trauma, that is led by our Department of Mental Health, around developing a menu of scalable psychological interventions, including for children and adolescents. We already have some some of these interventions that have been tested, rigorously tested, and are already available in the public, like PM Plus, which is being adapted for young adolescents, 10 to 18-year-olds. There's a manual interpersonal therapy, and there's a couple of things that, and then there's other things that are being tested in different settings, like an initiative called Self-Help Plus, sorry. And I think what we know is that it is possible to deliver some of these psychological interventions by non-specialists in low and middle income countries, and even in humanitarian settings. So even in very challenging settings, we have evidence that it can be done and that they do help to reduce stress and distress. And one specific one that I wanted to mention, which is still in the process of being developed and tested through an RCT, is called STAR, Sustainable Technology for Adolescents to Reduce Stress, which uses chat box. And I'm told by my colleagues that even apps are now very outdated and hard to manage, but you know, there are more simpler things that young people use that can be used to address some of these issues. I mentioned already the clinical handbook and training on care for children suffering from abuse and maltreatment. We're just starting work on developing guidelines around parenting programs, which is one of the strategies for which there's more substantial evidence to reduce violence against children. There will be a global status report on violence against children released later this year, which gathers data from all the countries around policies, laws, you know, programs for prevention, and you know, it provides an overview of what's happening in the countries, which is a useful platform to then also, you know, work with countries to build on that and do more. We are initiating work to develop a research agenda on intersections of violence against women and violence against children with UNICEF, UNGEI, and SVRI. And we are also in 2 countries working across the different departments in WHO that are engaged in this to look at what are the opportunities, you know, to map who's doing what in the 2 areas, what are the opportunities and what are the challenges of bringing the 2 together. And we, you know, we hope that by the end of the year, we will have some things to share about, from a very practical point of view, how does this play out in countries. And then lastly, we are updating the clinical handbook to address intimate partner violence and sexual violence, and we are integrating a section that will address specifically the issue of children exposed to violence in their mothers. And last, just a few thoughts for the discussion. I think we need to understand better the opportunities and the challenges on the ground, and hopefully, as I said, we will be able to have something to share on that. I think at the moment we have evidence of individual interventions that have been tested quite rigorously. Some of them are quite intensive in terms of the number of hours and they require highly trained facilitators, etc. So I think that one of the challenges around the discussion of scaling up is, before even scaling up, how do we move from those individual interventions to a more joint approach? How do we transform institutions? Because even if we have very good interventions, if we have a child protection system or a health system that is perpetuating patriarchal modes, that is discriminating against children, you know, it's very hard to ensure the success of the intervention. So we need to think more about that. I think there's a need for strengthening the evidence for addressing violence against children. I think a lot of the evidence that is in Inspire actually comes from interventions that have been developed for violence against women, and we assume that they will have an impact on violence against children, but I think there's a need also for developing more, doing more research and looking at interventions, you know, and innovation around those. And then identifying missed opportunities. As I mentioned, it starts at pregnancy. We know that maternal depression, postnatal depression have a very strong correlation with violence. And yet we are still struggling to integrate these issues there. And last but not least, you know, we focus a lot on the fact that children who've been exposed to violence are likely to go on to perpetrate or be exposed to violence. But when we look across the data, it is around 1/3 of those children who are exposed. So we also should be thinking about the other 2/3, you know, what are the factors that may contribute to not becoming a perpetrator, even though you have been exposed to childhood trauma, and to understand a little bit more around resilience and protective factors. I'll stop there. I have a few comments on what we've heard already, but I'll keep those for the discussion. Thank you very much. And just to say that I'm representing not just the work of my department, but across several departments in WHO. I will stop sharing now.
Dean, I think you're in mute. No. Okay. Shall we move on? Are you okay? Are you okay, Dean? Okay, I think we have had some technological challenges today. But yeah, thanks so much, Claudia, for the presentation. I think it's great to see more and more integration of the issues. And I also think it's interesting when I hear about these new technologies, using technologies, you know, for some new solutions to some of these problems, and this kind of more like solution-based approach, I think is great. And I also think your comment about more research and more kind of, you know, needed and interventions with on kind of with very much based on the ground. What are the challenges on the ground? And that makes me think, for instance, of South Africa, when we run our banning of corporal punishment, people living in very, very challenging socioeconomic settings telling us, oh, what do I do now? So we really need to invest a lot also in parenting programs. There also a question I could see in the Q&A little box, some person asking, so what about the disciplinarian mothers, you know? So I think we need to think also of what can we offer to kind of, in terms of good parenting for both men, women. We have a lot of single women in the country too, how we can offer also good parenting skills. So thank you for that. And I would like now to move on to Alessandra. And you have worked for a long time in producing evidence around on the intersection between violence against children and violence against women. So could you, Alessandra, tell us a bit about what UNICEF is doing on this? What have been the gaps, and what are kind of some of the solutions around this? Over to you, Alessandra.
Thanks so much, Angelica. Can you give me a thumbs up if you can hear me okay?
Perfect.
Does that sound okay? Okay.
Yes.
Thanks so much.
You.
And hopefully I'll be able to move the slides accordingly. I do want to start a little bit with the disclaimer, which is, you know, as I mentioned in the beginning, I am based in Italy. As you know, we are under lockdown, and I'm mostly handling it okay, but today I feel like I'm a little bit scattered. So I do apologize in advance. I will try to be as focused as I can. And also, as I mentioned in the beginning, I am currently based at UNICEF Innocenti. This is UNICEF's Office of Research. Obviously, UNICEF does research across all of its levels globally, but this is sort of the mandated office for research. And I joined this office about 6 months ago. but have been working in the violence against women and violence against children field for over 20 years now. And as we've started to hear already, not just in the presentations, but also in the Q&A, which I've been checking in, these the fields of violence against women and violence against children are fields that have developed in very separate and parallel ways, and at times have been, at odds with one another. We see a question on the Q&A about what happens when women perpetrate abuse against children. That's one that comes all the time. Leila also mentioning the issue of women's failure to protect their children from witnessing the violence that they themselves, women, are experiencing. So there are all of these issues that come up. And one might think that it's really quite surprising that it has taken us as long as it has as two fields to reach out to each other and to try to identify opportunities for coordination, and really the need for us to collaborate more closely. And I think that at least has been a result of increased evidence. These are fields that I think on both sides really have their roots in activism, not necessarily science, but that they have grown really exponentially in the case of violence against women. And I do agree with Claudia that violence against children is a little bit lagging behind in terms of the evidence of interventions. But as these new data have come up, and some of which you've seen from the VACs and beyond, we see the multiple ways in which these forms of violence intersect. I think the focus of this webinar is in one of those intersections, which is children's early exposure to violence directly or as a witness, and the impact that that may have on many things, including adult perpetration or victimization. But a couple of years ago, Claudia Garcia Moreno, who's on the line, myself, Sarah Bott, and Manuela Colombini published a review, and this is when I try to move my slide, and we'll see if that happens. Yeah. We published a review called Bridging the Gaps, a global review on the intersections of violence against women and violence against children, where we tried to map the different forms in which these manifestations of violence interact. And you see number 4 there is the one that we're talking about a little bit more in this webinar, but I do want to raise our attention to the fact that there are other ways in which these forms of violence intersect, and to share some ideas about what that means in terms of prevention and response. And then I will end my presentation with some key considerations for us to think about, and we'll share very briefly some of the work that we are doing at UNICEF, including UNICEF Innocenti. So, we've seen already that there are a number of risk factors that are shared in terms of the perpetration of violence against women and violence against children. And they range from gender inequality being a very key one, to the lack of responsive institutions. And what follows is, and I think that this is what needs to be put to the test, is that if there are overlapping correlates for these forms of violence, could consolidating efforts to address these shared risk factors contribute to both preventing violence against children and violence against women? And that's sort of our hope. I think that there's some incipient data on that, but I think that that's something that we need to put to the test. Another important intersection is the fact that globally, there are some social norms that are shared and that contribute to both the perpetration of violence against women and violence against children, and to what happens after, right? And colleagues at the London School of Hygiene, at Prevention Collaborative, a number of other places are looking at these social norms and identifying the social norms that are shared, including, for instance, condoning violence as a way to address perceived misbehaviors, whether that's corporal punishment of children, or whether it's because women are not fulfilling their quote-unquote role in the household. But there are also norms around blaming victims, right? Whether it's what the woman was wearing or what the child was doing, and of prioritizing family reputation over victims' rights. And those types of norms have a number of implications for help-seeking behavior. It's not surprising then, as we're seeing all of these correlates, that there's a lot of co-occurrence of these forms of violence in households where women are experiencing abuse. Children are more likely to experience abuse, and vice versa. And as I said, the issue of intergenerational effects has been the focus of this webinar. And what we see also is that whether it's children or adult, in this case adult women, experiencing these forms of violence, the consequences tend to be quite similar. If we look at sexual violence against children and against women, and other forms of abuse. And not surprisingly, again, they are compounding. So a child who has experienced violence is maybe more likely to experience violence in adulthood, and those two experiences added together are likely to have more severe or long-lasting consequences. And the last point in terms of the intersections that we found is really what happens around adolescence. Because in theory, if we're looking at children as the age group of 0 to 18, and when we look at violence against women, particularly if we're looking at prevalence data, we usually have data sets that look at 15 to 45. There is like an age group there, which is the adolescents, that overlap both areas of interest. But what tends to happen is, you know, usually those who are working on child protection and violence against children are looking at the younger age groups, or even if they're looking at the older age groups, they're seeing them without taking into account their development, their age, and so oftentimes missing what's happening to adolescents. For instance, it's not very often that one sees child protection looking at intimate partner violence against adolescents, even though we know that that's an age group of risk. And so what happens is that that age group tends to be missed out by both fields, even though it should be the opposite. It should be of interest to both fields. So when we looked at these different ways in which these forms of violence intersect, we started to think about, well, what does that mean to practice, and what could be the potential collaborative solutions? And I love that Leila has mentioned, you know, the importance of helping the legislative system and laws reflect the dynamics of domestic violence. Whereas on the surface, when one may want to blame a woman, for example, for failing to protect their children, and the impetus may be to take that child out of the household at any cost to protect that child. You know, if you don't understand the dynamics of domestic violence, you may actually be failing to see that that woman is doing everything that she can to protect her safety and that of her children, and that rather than cause additional trauma by removing the child and punishing the mother, we really need to strengthen that that woman in the household to make sure that she's in a situation where both she and her children can be safe. So I think implementing and enforcing laws that take into account the dynamics in both forms of violence is really important. Also, as we've said already, changing social norms. What are the norms that are amenable to change, and what are the norms that are shared? And can we put to a test and see if we are able to change these norms? Can we see a reduction in the levels of violence against both children and women? And then obviously, I think an area that's prime for collaboration and coordination is the response, right? If we have services that are looking at caring for children who are experiencing abuse, but they're not looking at what's happening to the mother in that household, they're likely to miss an important component of that child's care, and vice versa. And prevention as well. You know, what are the interventions that we can put in place? We've seen some efforts to look at both forms of violence within the context of parenting or home visitation programs. What are the other opportunities that we can combine our resources, human and financial, to try to prevent both forms of violence in a coordinated way? And we've also been seeing some efforts to integrate a gender perspective into microfinance programs. We know, and as Claudia highlighted, income strengthening or reducing poverty is a key component of both the Inspire and the Respect framework. But how can we do that, taking into account gender norms, so not only are we able to be more effective, but we also minimize our chances of causing harm inadvertently. So some of the key messages, I think the first one, I'm not surprised anymore, but I think it's really curious how we often tend to approach this idea of coordination, assuming that one side must lose for the other one to win, which in math, we call the zero-sum game. So there's a need for us to coordinate. There may be very valid reasons for vertical programs. We have as my diagram, you hopefully can see, you've got an area of interest for violence against children, you've got an area of interest for violence against women, and you've got a big chunk of that may be of shared interest. I've heard multiple times, whether I'm talking to colleagues who are mostly coming from the child protection or violence against children or from violence against women, is, we're already overextended. I can't put anything else on my plate, which I very much respect and understand. But I think that we need to think also that it's not doing additional work, although that may be required, but it's also about improving the effectiveness of our programs. Because let's see, if you are providing services to children who are experiencing abuse, but you're completely disregarding what may be happening to the mother in that household. Well, we know from the evidence that exposure and witnessing violence against one's mother can be an even stronger predictor than being a victim directly of that violence. The effectiveness of your program, no matter how good it is, it is not going to be ideal. So I think helping us to change that mindset is really important. I think also that it's really key for us to recognize that patriarchy is alive and well, unfortunately. And if we forget that this is a political field, particularly for violence against women, but violence against children as well, I think that we will be failing to anticipate and understand where tension comes up. I think, and as I mentioned,
Alessandra, sorry, you have like 1 minute.
Sure, I'm wrapping up, so
that,
no
yeah.
worries. We are brought to these fields because of our passion to protect children or to fight for women's rights and safety, and that can sometimes predispose us to being at tension with each other. And finally, I would say, 2 things. Keep in mind that feminism is about equality. It's not about one over the other. And let's try to focus on the end goal, which is children and women being safe. So my last slide is just to share with you very quickly, or next to last, some of the work that we're doing. Claudia mentioned already that we're developing a global research agenda to map priorities for researching the intersections between these forms of violence. We are also working with the London School of Hygiene to update an evidence review on what are these coordinated approaches that we can use to address both child maltreatment and intimate partner violence. We are working across a number of areas within UNICEF, including gender and child protection and UNOCENTI, to develop guidance, internal guidance on how we can respond to our knowledge and the evidence on these forms of intersection. We are analyzing the co-occurrence of child maltreatment and IPV across several countries in Latin America. And we're working with our regional office in East Asia, in the Pacific region. They've been carrying out a multi-country study, again, trying to identify these opportunities for coordination with UNFPA and UN Women, and we're working with them to finalize that. As Claudia mentioned, I think it's really now identifying these opportunities and trying out different models and evaluating them well. And then I just wanted to share with you these 2 things that are going on now that may be relevant. One, the Lancet is starting a commission to look at gender-based violence and youth maltreatment. It's not clear how much of it's going to focus on these intersections, but I think if you're interested in this area, it's something to keep an eye out for. And there's a special issue of the Child Maltreatment Journal coming out that will focus on the intersections, and the deadline is coming out May 1st, so that's coming out quickly. Thanks so much for the opportunities.
Thank you so much, Alessandra. I think that was excellent. You really gave us key messages, so I'm not going to repeat those, but just to say also happy to see that more research is going to go also in Latin America, in the South. We know that there's a lot of evidence research from countries on the North, so good to see something happening in the South. And now over to you, Dean, to introduce our last two panelists for the day. Thank you. Dean, we cannot hear you. You're mute, okay.
Dean, you are still muted.
You are still either muted or something is happening. Sorry. So, Dean, do you want me to pose the question? We cannot hear you. Okay, so yeah, sorry. I think, sorry about the technological issues, but just to introduce Sujata Burdoloy. She introduced herself at the beginning, so we are going to go on with her presentation. Thank you so much, Sujata.
Can you hear me, Angelica?
Yes, we can hear you well. Yes, perfectly. Go on. Thank you.
Okay, so I realize that we have 5 minutes.
Yes, sorry, yeah.
So I will try to be brief. And I think I learned so much from the previous presentation, and I'm very feel very honored to be in this panel. And I think what I bring is from the education perspective what we've been doing in terms of advancing gender equality in and through education, and gender-based violence being one of the key barriers that we've seen, which stops both girls from accessing education, but also impedes learning for both boys and girls. So quickly, another slide with a lot of logos in it. I represent and coordinate the Global Working Group to End the School-Related Gender-Based Violence. This was essentially formed in 2014 when a group of 35 of the leading agencies and donors came together, and they recognized that gender-based violence was in fact a reality for millions of students, and it was hidden. And so many of these organizations had been working on these issues and coming at it from the education, child protection, violence against women, gender sectors, and that there needed to be a consolidated, coordinated effort to bring this issue to light in the background of the framing of the Sustainable Development Goals. So the working group is hosted by UNGEI and UNESCO, and it was essentially established as a community of practice, you know, bringing together different actors representing sort of civil society, bilateral, multilateral donors, academia, UN, education unions as well, to kind of promote and the generation of evidence and knowledge, to bring out what works, or initiatives or promising approaches that countries were engaged with, and bringing that to the global forum to amplify a focus on SRGBV and its implications for achieving the SDGs, and a strong policy advocacy mandate to make sure that this was firmly entrenched within the SDG framing. So what is school-related gender-based violence? The definition was developed, again, collectively through many of the organizations. Essentially, UNGEI and UNESCO then produced a policy paper through the Education for All Global Monitoring Report. And I want to just say 3 things about it, which I think the panelists will agree and understand coming from a gender perspective, but it was not so obvious within the education sector that gender and power inequities between teachers and students, older and younger students, girls and boys have an impact on violence in schools. and that gender interacts with other factors of marginalization, such as poverty and disability, and social and economic status, race, ethnicity, and all these other factors, and increases the vulnerability of some students over others. And the fact that gender-based violence is a reality within the school setting as well. Number two, that the fact that gender norms which exist in the community and in society get mirrored and reinforced in schools oftentimes. And so when punishment is used against a child or even teacher's experience of violence, it is a manifestation of norms, wider, unequal, and harmful norms. And in order to address the intergenerational cycles, it is then critical to also look at the education sector and use the tools that we have available to both transform the school system, but as well as use education as a transformative tool to address and shift gender norms. So with the with the collective advocacy by the UN Girls Education Initiative and its partners, it led to specific language in the Incheon Declaration, which for the first time actually acknowledged that this is not just a human rights issue, but also an education issue, and that it needed to be addressed in order to meet the education outcomes of the Sustainable Development Goal 4 on quality education. So in 2016, UNESCO and UN Women and with the members of the Global Working Group sort of looked at a review of the various initiatives, case studies, programmatic examples, and the research and evidence on school-based interventions tackling SRGBV. And it identified 6 areas that form a comprehensive program of action, which could be embedded within the education sector and more likely to lead to improvements broadly in gender equality, reducing gender-based violence, and supporting students and teachers who experience violence in and around schools. So the first one was about leadership and political will. And essentially it was, again, saying that what the guidance found or the practices found was that there needed to be multi-sectoral plans, but also education needed to be more firmly entrenched within the broader policy reform and laws against violence against women and violence against children. And that it needed to be wide-scale action in terms of GBV, gender-based violence, and schools. The second piece is about school environments and includes leadership required from the school management and governing bodies to commit towards a zero tolerance against gender-based violence. So translating the policies and laws into safer school environments, which includes a range of both policy actions as well as preventative measures, which is the third point around curriculum and teaching and learning. And within this component, the recommendations were about supporting teachers to develop effective learner-centered pedagogy and tools to recognize and address SRGBV when it happens. So using the education workforce or preparing the education workforce to be more responsive to violence when it occurs both within the school as well as at home. Number 4, about responses, so looking at violence in and around schools, primarily establishing confidential reporting mechanisms, and then the provision of counseling and psychosocial support, linking with the social services sector to strengthen the education sector's capacity to respond to violence when it occurs in and around schools. And as we know, these objectives can't be achieved without working in partnership with other sectors. So civil society, ministries of education, teachers unions, families, and communities. And as Angelico also talked about, parenting programs and working with parents are essential to make that make that happen, essentially. And finally, given the paucity of reliable evidence on the scale of SRGBV, we also need better measurement, monitoring and evaluation, and documenting examples of good practice to be able to build knowledge about safe and effective approaches. So these 6 kind of a framework for action, if you will, that the global guidance presented was a blueprint for ministries of education to look at this issue within their own sector plans, within their own education reform, and embed what the missing pieces, and recognizing that this is obviously an ideal scenario, but it also provided a guideline for them to think about this issue in a more holistic and whole system approach. So over the last 5 years, the global working group has been convening regional workshops or regional learning symposia, which is bringing together sort of ministries of education, civil society, and other actors working at the country level to address these issues. And we are finding a lot of initiatives and promising approaches that people have, that these actors are engaged with. And even though the evidence is limited around school violence prevention, which have explicitly considered gender as a factor of analysis and have addressed gender-based discrimination as a key driver of violence, the body of evidence is growing. And again, when I say evidence, I don't necessarily mean RCTs or rigorously evaluated, but what I mean is a more coordinated approach where different actors are working together to address this issue. So what we found was that that child protection solutions to SRGBV do require systems and strategies that work not just at the national level, but also district and school levels. And the country examples that we found highlight that the education sector has an important role to play. We are learning that effective solutions work in a multidisciplinary and multi-sectoral way, which others before me have said. And that we find that to manage the power dynamics and the institutional weaknesses that that kind of perpetuate violence, both at home and in school, there needs to be a better mechanism for these different sectors to work together. So at the national level, some key areas where we've seen that the child protection and social welfare departments and ministries have worked together to make strong linkages are around, for example, revising teachers' code of conduct and professional ethics and getting them into the hands of every teacher, promoting peer-to-peer education through children's clubs. Tuseme is one approach which enables children to speak out and report violence when they see it, or offer peer-to-peer support, strengthening counseling systems in schools. Many education systems have guidance and counseling teachers and linkages with social workers. Some are better implemented than others, but there is a framework which can be used. Dissemination of clear referral pathways in schools, specifically for reporting sort of violence and abuse, as well as sexual violence within school, and promotion of whole school models. So I'll just highlight 2 examples that I can draw from, and the visuals that you see on the right side of the screen are the publications that we've put out over the last 5 years. And these all highlight sort of promising approaches and case studies from various contexts that we have heard from our partners and who have shared it. So there's one from Western Central Africa, which is in French, and then the thematic briefs are both from West Africa and Eastern Southern Africa. So 2 examples that I just want to quickly highlight. One is around establishing a national code of conduct in Ethiopia, which was developed in 2016. It was led by the Ministry of Education with support from UNICEF, and the Ethiopian Teachers Association, and several civil society organizations, and also representatives from health, gender, justice sector, and the police department. And this code addresses gender-based violence by school staff and students, and it also includes guidance on sexual harassment, which was not part of the administrative guidelines before. This code also emphasizes that a disciplinary committee should exist within each school, with members from the school gender clubs, the students, teachers, parents, and school leadership. And it is being rolled out in all the regions in Ethiopia, along with training of teachers who serve as gender focal points in each school. This initiative was, when it was rolled out, was also evaluated by the Institute of Education. And it was found to be quite a interesting and a model with a lot of potential. Obviously, they found issues like dissemination and the challenges with clear roles and responsibilities. But the fact that it was led nationally by the ministry and the rollout was sort of across schools with specific designated gender officers within each school was a promising approach. The second one,
sorry,
yes,
you have 1 minute.
Yeah, and this is my last point, so I'm good. The second one that I wanted to highlight is the Forum for African Women Education in Zimbabwe, who are leading, with support from UNGEI and UNICEF, a piloting of minimum standards of a whole school approach to prevent SRGBV in 2 districts. And the pilot aims to strengthen school systems by working with school heads and district education officers to improve and strengthen their attention to school-related gender-based violence. It's using already existing Ministry of Education sort of structure of guidance and counseling teachers to use improve their skills in using positive discipline to recognize SRGBV, respond and report as incidents occur. And these guidance and counseling teachers already have a mandate to disseminate curricula about sexual and reproductive health and gender violence and life skills. However, again, because of, we understand the implementation gap in some of these policy systems. So FAWEZ is working very closely with them to actually strengthen their skills to be able to deliver some of these curricula. And they're also working with learners to speak up and lead efforts through the student council and through their Tuseme approach, which is about speaking out. And lastly, supporting these schools to establish codes of conduct or school rules around preventing, reporting, and addressing gender-based violence, and includes making linkages with social services and other community-based referral channels. FAWEZ, those of you who may not be familiar, is a regional body which has been working on gender equality in and through education for the last 20 years. So they have a very strong background in gender responsive pedagogy and addressing gender discrimination and violence in and through education. So their skills in using a gendered approach when it comes to school violence prevention has been a very positive influence on the work. So these are some examples of work that's going on. There's a last one about education unions, which I will not get into, but I'm happy to speak to it if there is time. And please refer to our publications, and if you are interested in learning more about the UN Girls Education Initiative work, join us through these channels. Thank you.
Thank you so much, Sujata, and I'm sorry about pressurizing you, but I think, yeah, we ran a bit out of time, and thanks so much for reminding us that schools are really a key space to identify and respond to address gender-based violence and violence against children. So thanks so much for that. And I think people have seen a lot of documents going on also in the chat, so there are a lot of resources and you can also share there. And now, last but not least, I would like to introduce you to Katharina Anton Eriksleben. And Katharina, the global partnership to end violence against children has secured the commitment of 30 pathfinder countries. And 13 countries are endorsing the Safe to Learn initiative, which is supporting organizations to address online violence. So just get to tell us a bit of, in closing, kind of what are inspirational stories at country level on how this has been done and what can we learn from the experience. And I think I'm sorry to say we have like 5 minutes, but we still have 80 people listening to this conversation. So thanks so much for waiting. Over to you.
Thank you so much for the introduction and the great question. Let me see how the slide sharing works. Can you see my screen?
Yes, perfect. We can see it, yes.
Fantastic. Okay. So the global partnership is really based on the idea that to address an issue so ingrained and so complex as violence against children, we really need the coordinated action of many different actors, including different sectors, and also different types of actors, including governments, international organizations, and national NGOs and others, and donors, of course. We currently have over 400 partners involved in the partnership. And in addition, we have a fund that helps us support targeted activities, really linking the global advocacy to national level change on the ground. We focus on 3 main entry points, like you mentioned. One, growing demand for change through the pathfinding countries, ending violence in and through schools with the Safe to Learn initiative, and then also ending violence against children online with a specific focus on sexual exploitation and abuse. And if time allows, I would really like to share just a few examples for each of these different areas. This map shows all of the different pathfinding countries we have. Pathfinding means that a government has formally and publicly committed to changing laws, policies, and societal norms for comprehensive action to end all forms of violence against children. And as part of this commitment, pathfinding countries develop action plans, which are focused around implementing the Inspire technical package with support from the End Violence Partnership. And the idea is really that pathfinding creates a sense of ownership within the countries and cultivates a homegrown approach that is relevant to a country's specific context. So there is a common pathfinding framework, but how that is taken forward really depends on the unique situation and context in the country. And just to mention a few examples, Uganda is one of the earlier pathfinding countries, became a pathfinding country in 2016, has really invested in getting data, conducting a large-scale national survey on violence against children, its manifestations and drivers, and is now using the results of the study to inform the country's national action plan for ending violence against children, and also other strategies, for example, multi-sectoral framework for adolescent girls that specifically focuses on violence against young women. Mongolia, similarly, Mongolia became a pathfinding country in 2018, so a bit later, but similarly has published a national action plan and has recently allocated over 3 million specifically for ending violence against children. And there are now 600 multidisciplinary teams led by non-governmental organizations in Mongolia that work on responding and identifying issues of violence against children, and along with a national helpline that has been established. Canada also became a pathfinding country in 2018 and developed a roadmap of actions to address violence against children over the next few years, which launched just last year in 2019. And what's interesting about Canada and really encouraging is that this roadmap really places a special focus on acknowledging at-risk communities like the First Nations, children with disabilities, and LGBT youth. Several of the pathfinding countries have also signed on to the Safe to Learn initiative, which is an initiative dedicated to ending violence in and through schools. Without going into too much detail, I think all of us know and have heard that violence in schools is a huge issue around the world. About 250 million children are affected by violence in and around schools. At the same time, schools are a really strategic entry point to address violence against children beyond the school setting itself. Schools are places where children not only learn about academic subjects, but where they really learn about what's right and wrong, learn how to solve conflicts, how to build relationships with others. So promoting safe and positive learning environments can really shift norms in communities beyond the school setting itself and can help end the intergenerational cycle of violence. The Safe to Learn initiative currently has 14 partners whose logos you can see there. Together with these partners, we've developed a call to action, which sets out in high-level terms what needs to happen to end violence in and around schools, and what each partner will do to implement that call to action. At country level, only 13 countries have endorsed the call to action. Most recently, Jamaica, which just came on board last week, which is really exciting. And Jamaica is a really interesting example. Is in addition to committing to the 5 areas of the call to action, Jamaica has really embraced this idea of child participation. So throughout the process of a call to action endorsement, Jamaica has made an effort to involve schools and children themselves. So starting with the moment in November 2019, last year, where girls and boys had a chance to directly share their experiences of violence with the Jamaican Parliament, along with the action they would like to see from their government to address it. And with support from the Global Partnership, these children also participated in a competition to create safe spaces, so peace gardens within their schools. And it's just a really nice example to show that children can and really should be agents of change, and we should look to them for solutions. So these examples all are focused on the manifestation of violence in the physical space, but we know that with the rise of the internet, we see more and more violence and exploitation happening online, and it is really critical that we make sure that these new digital spaces that affect children's lives aren't increasing the threat to children to experience violence and exploitation. Since 2016, through the End Violence Fund, we have supported over 37 partners to respond to this issue, including rescuing victims of online sexual abuse and supporting survivors, establishing reporting hotlines, contributing to awareness raising among both adults and children, and also strengthen law enforcement and legislative reform dealing with these issues, developing solutions by partnering with the technology sector as well. So just to mention 2 examples really quickly. In the Philippines, for example, we've supported the International Justice Mission to work with local authorities to strengthen the judicial response to live streaming of child abuse. And as a result, the organization has rescued 152 children from ongoing situations of online sexual exploitation. Another example, Kenya has just opened its second child protection unit in Mombasa, which will help the Kenyan police zero in on child sexual exploitation, abuse, and trafficking. And what's interesting is that this is also a really good example for donors coming together. So this was made possible by a collaboration of donors, including the UK government, UNODC, UNICEF Kenya, with support from the End Violence Fund. So these are really just a few examples and just a small slice of what is being done globally and at country level. I would say that the examples are encouraging and that they show that progress is happening, even though we all know that much more work needs to be done. At the partnership, we are currently focused on advocating for more countries to become pathfinding countries and for more countries to endorse the Safe to Learn call to action. And are also, of course, continuing to influence the global debate across all of these three areas, including online violence. The End Violence Fund just recently closed its fourth funding round, open call, focusing on online violence. And we are really excited to start working with the next cohort of countries. In addition, we are developing a new Safe to Learn fund window, thanks to a contribution from DFID, and are beginning to program in Nepal, Uganda, and South Sudan. We are also working with partners globally on advocacy to secure more dedicated funding for ending violence against children everywhere. And I'll stop here. Thank you.
Thank you so much. And I think, yeah, you remind us of new spaces of violence. I think, Katharina, the issue of online violence is very real, I think. We tend to forget about that sometimes, older people maybe, but it's super important and very impressive the work you are doing, and also that your grant portfolio around that. So unfortunately, we are not going to have much time for questions from the participants. We still have 72 participants though, and because of technological issues, Dean cannot close now. I think they're still not connected. So I would just like to round up with some few issues. Just to, first of all is, and I think very important point made by Alessandra, this is should be a win-win situation, not a competition or tension issue between women's rights, violence against women movement and violence against children. How we can work better, how we can collaborate better, that's a key one. And one very important point, how we do not penalize women. And I think that was the presentation, also the first presentation around what's going on in the US. And we know it happens in other parts of the world. That's a very important one. Secondly, I think the issue of schools as a key space to identify and to address the two types of violence. So how we can improve that. And the two last participants, I think, gave us a lot of food for thought around that. I think also the last point to me is, please, all the participants you receive, I think the colleagues at Promundo shared the paper, do read it, do think about it, and start thinking about how we scale up what's going on. We know there are good things happening there. What can we do better? Where is that we need more research? I think we still need a lot of research in, I think, more low-income countries. You will see in the paper too. So think about it, read. But I think one of the key things, although that comes in this document, is we need more services. And we need services from, we don't need maybe, we need a lot of professionals, but there are also ways we can do. Some of the examples you will see here is with lay counselors. In Africa, particularly in some of the countries where good interventions have taken place, is done with lay counselors. So how we can really improve the services to be provided to children exposed to violence. And as I said, as I show you I told you about what's going on in South Africa, is key that we intervene at early stages, definitely. And all the other presentations said exactly the same. So please do read this. And I just wanted to apologize on behalf of Promundo for the technological issue, but also to a big thanks to Promundo team and to Dean in particular, because it's been a passion of his to talk about this topic. And I do hope we continue talking about this. And thanks to all our panelists, and thanks for your patience to stay with us, and the participants. I can still see in the screen 70 people. Thank you to you. I can see the passion, the interest in the topic. So let's continue the conversation. And thank you so much, and till next time.